In this video, we will explore the OET speaking role play for occupational therapist. So this is not a script that I'm going to give you. This is a thinking structure you can adapt instantly. Okay. So I call it as a care, move, empower framework. It has different phases. So let's move on to the first phase. When I talk about phase one, that means build safety before treatment. So that's the care phase one. The goal is to make the patient feel heard, to make the patient feel safe, and make them feel as respected, in control. What you do here is you have to greet them warmly and professionally, and you need to confirm their identity and purpose. And then you can acknowledge their emotions or concerns, then explain your role as an occupational therapist in simple terms. So why this matters for OET is OET examiners, they want to see the rapport and they want to see the empathy that you're going to give and also the clear role explanation. If you rush this, even perfect English later won't save your score. Got it? And let's move on to the phase two. So this is the move, which means you have to explore the function, not just symptoms. This is where OET candidates must shine. The goal here is to understand how the conditions affects daily life, not just the diagnosis. Okay, so what you explore here is instead of asking only medical questions, you have to focus on daily activities like ADLs or IADLs and their work, home, self-care, leisure time, what they do, and their environmental or emotional barriers, if any, and how the patient or what they can do versus what they struggle with. Got it? So here the key OT difference is doctors ask where does it hurt, but occupational therapist you have to ask what has become difficult because of this. So this distinction is gold in OET. And the phase three is align, which means set the goals together. This is a big scoring area. Most candidates miss this. Okay. And this phase goal, the objective is that you have to show that you are patient centered care. You're providing that patient centered care, not just instruction giving. So, what you do here is you have to summarize what you have understood. You have to ask what matters most to the patient and try to negotiate the priorities in a very collaborative way. Example like, what would you most like to be able to do independently again? Because this shows that you are sharing the decision making, right? You are expecting answer from the patient also, and you are also respecting the patient autonomy. So this is real clinical communication. And the phase 4 is guide, which means explain the OT plan clearly. So here, language clarity matters more than the fancy vocabularies. The important objective of this phase is you have to help the patient to understand what the OT will focus on, how therapy will help their daily life in order for their survivals or to maintain their simple day-to-day daily habits or routines, right? So what sessions may involve. So you can try to include a simple explanations, step-by-step approach, or you have to provide reassurance about the pace and support. Here, you're not supposed to use the medical jargon unless you explain it clearly. Got it? So think like, explain like you would do to a real patient, not an examiner. If the real patient comes, you will not use so much of medical terminologies, right? Because the patient might not be aware of this. Of course, an examiner might know, but not the patient. So here you have to explain how you explain to a real patient. Got it? And the fifth phase is empower, which means encourage independence and confidence. So this is your closing power move. And the objective is you have to leave the patient feeling supported. You have to make them like, feel them like motivated. They should be confident to try out the strategies. So for that, what are the things that you have to do? Try to get some questions from them. So try to ask questions. Okay, how do you feel about it? Let them come up with their answers. You can pose some open-ended questions, not like a closed one, right? And you can check their understanding by, again, you can ask them questions whether they have understood or not. Then you can just acknowledge them, follow up with their support, and then finally you can end positively and professionally. So this phase often decide whether you score B or B plus or A. Got it? So let me tell you why this framework is unique for occupational therapists, because most OET frameworks are very much doctor centric, problem focused, instruction heavy. But this framework, whatever I have given you, the CARE framework, right? So that is function focused. It's participation based and patient empowering, which is exactly what occupational therapy is about. Got it? Now, this is the role play card. If you want, you can just pause the video and you can read it. The setting is the community rehabilitation clinic. Your role is you're an occupational therapist. Patient name is Mrs. Linda Thompson, 62 years old. And the background information is Mrs. Thompson experienced a mild stroke 7 weeks ago, affecting her left side. Her medical recovery has been stable and she has been discharged from hospital. However, she reports ongoing difficulty managing daily activities at home. She lives with her husband and is particularly concerned about her independence with personal care and household tasks, especially cooking. And your task is in this role play, you should build a rapport, explain your role clearly, explore how the stroke is affecting her daily functioning, and you have to acknowledge emotional concerns related to loss of independence, discuss occupational therapy strategies to support independence, involve the patient in goal setting, and reassure and encourage the patient. So, all the things that we have discussed that you have to incorporate here, right? Let me give my response. Okay. Hello, Mrs. Thompson. My name is Catherine, and I'm the occupational therapist who will be working with you today. Before we get started, could I just confirm your full name and date of birth? Perfect. Thank you. So, Mrs. Thompson, before we talk about anything specific, I would like to explain my role a little so we are on the same page. As an occupational therapist, my main focus is not only on your medical recovery, but on how your stroke is affecting your everyday life. Things like getting dressed, showering, cooking, and managing around the house. The goal is to help you feel as independent and confident as possible in your own home. Now, I would really like to hear from you. Since you have been back home, how have things been going day to day? Okay, it sounds like physically you have noticed some improvement, but certain activities are still much harder than they used to be. I can imagine that's quite frustrating, especially when you were used to do these things independently for so many years. And it's very normal to feel that way after a stroke. And I'm really glad you are sharing this with me. You mentioned that cooking has become challenging, right? Could you tell me a little more about what happens when you are in the kitchen? Is it more about using your left hand, standing for longer periods, or feeling unsure about balance and coordination? Right, that makes sense. So it seems like reduced strength and coordination on your left side are affecting how confident you feel, especially with tasks that need two hands. And what about personal care such as dressing or showering? Are there moments where you feel you need extra help or feel unsafe? Okay, thank you for explaining that so clearly. What I'm hearing is that you can still do so many things, but you are relying on your husband more than you would like. And that's affecting how independent you feel. That loss of independence can be emotionally difficult, and it's something we take very seriously in occupational therapy. If you think about the next few weeks, what would you most likely to be able to manage on your own again? Would it be preparing simple meals, getting dressed more easily, or something else that's important to you? Oh, that's really a good goal. It's also very achievable. What we can do together is we focus on some practical strategies to make these activities easier and safer for you. Okay? For example, in the kitchen, we can work on ways to organize tasks so they require less effort. practice techniques that protect your weaker side, and introduce simple equipment if needed, only if you're comfortable with that. Okay? Throughout our sessions, I'll also keep checking in with you to see what's working and what's not because your feedback really matters. Okay? So, if you have any concerns or questions you would like to talk through, you can just share it with me. I want you to feel supported, and please remember that progress after a stroke takes time, but you're already moving in the right direction. Okay, so let me tell you why this response scores high in OET speaking. It has a strong rapport and relationship building right from the very beginning. I have used like the proper structure. I have treated professionally, confirms the identity, and explain my role very clearly, right? And have used a calm, respectful tone. So this immediately builds trust. The patient is treated as a person, not a case, right? Examiners rewards this heavily. And also, if you see, the response never sounds like a doctor or physiotherapist. It consistently focuses on the daily activities, independence, home function, and confidence. So, this shows strong professional identity, which OET examiners look for. And of course, as I told you, very much patient centered exploration. I have invited the patient to explain, and they have reflected their feelings. I have used open ended prompts, right? So, these things demonstrate active listening and empathy. Both are the key scoring areas, remember that. And of course, very important thing, emotional concerns are acknowledged naturally, right? So the response does not ignore emotions or label them clinically. It validates them in a plain English, which shows emotional intelligence, cultural sensitivity, real world communication ability. So, this is exactly how OET expects healthcare professionals to speak. Got it? So, try to incorporate all these strategies in your OET speaking. And that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.